We have learned the health department confirms one person is dead after contracting Legionnaire's disease.
Yesterday, we told you the state and the Queens Medical Center were investigating after 4 recent cases at the hospital. So how is this impacting operations? And are patients and workers safe?
Bridget Namata has been on the story all day, asking tough questions to find out what we need to know. Bridget.
Well, Marissa, according to Queens, it is still safe for patients who come to the medical center for treatment. But as a precaution, it is following state's orders by taking extra steps to keep those likely from getting Legionella, those with weakened immune systems, safe.
We don't know the name of the patient who died from Legionnaire's disease due to privacy laws. But Queens Medical Center says the patient, who passed in May, had an underlying medical condition.
The patient had symptoms of pneumonia at the time of admission, so they presumably got the infection before they arrived in the hospital.
Doctors believe that patient, along with another, got Legionella from outside of the hospital. But the health department got involved when it learned the other 2 patients were hospitalized at the time symptoms flared up, meaning it's possible they contracted the disease from within the hospital, which is why they launched an investigation. You can get the infection by inhaling bacteria through water sources like showers and air conditioners. Legionella has an incubation period of 2 to 10 days.
Would you advise patients to stay out of Queens until this is resolved?
No, absolutely not. And again, I want to remind people, the first thing in any Legionellosis investigation that we do is make sure about the safety of the patients. We work with our healthcare facilities. And again, I want to say Queens is an example of how we would hope that any healthcare facility in any future, would respond.
Since then, Queens is focusing on keeping high-risk patients away from possible infection.
Those are cancer patients, people being treated for cancer, people with severe underlying lung disease, transplant patients.
Queens has not allowed patients to flush the toilet or take showers. They can only drink bottled water, and they're replacing all of their faucets.
At one point, I also asked the health department if they would consider shutting down Queens Medical Center if test results show Legionnaire's disease was contracted from within its walls. According to Dr. Park, they would only consider shutting down the hospital if at least 100 patients contracted the infection. Back to you guys.
Well, Bridget, thank you. So what is being done to find out where those patients got sick, and how long might that investigation take? Jen Boniza getting answers, and also joining us from just outside the Queens Medical Center. Jen.
The Department of Health says that Queens Medical Center is being looked at as a potential source for Legionnaire's disease in 2 of the recent cases. Again, we want to stress a potential source. I'm told the investigation is ongoing and that recent water testing results may not be available for days and possibly even weeks. I met with state epidemiologist Dr. Sarah Park. She tells me the investigation is complex, requiring a 2-day sampling period.
Some of the samples that are being collected are being sent to try to attempt culture. So that's going to take some time. It could be up to 2 weeks, potentially. Could be even longer. It just depends on how fast this bacteria might grow. It depends on how much is found in each sample.
The Department of Health tells me that Queens Medical Center is going above and beyond what is required to ensure the safety of its patients, taking several additional precautions.
They limited exposure to water fountains, for example, and instead are handing out filtered water so that they don't have to worry that their patients might be exposed to the spray from the water fountain.
Dr. Park tells me they've even moved the 2 patients with Legionnaires out of their rooms.
As far as I understand, and closed those rooms as a precaution again to make sure that if the room that they're in is a potential hazard, then they're not in use right now while we continue our investigations.
The CDC states hospitals are required to develop a water management program to reduce the growth and spread of Legionella in buildings. There are internal and external conditions that could contribute to Legionella growth. Internal circumstances include sediment, water temperature fluctuations, changes in water pressure, pH level, water stagnation, and inadequate disinfection. External contributors are construction, water main breaks, or changes in water sources. I wanted to know if the ongoing construction at Queens could be a factor.
We have sampled the cooling towers, but there's been ongoing construction actually or revision for quite some time with our cooling towers. We are investigating that, and we have cultures pending from that.
I can tell you
that's less likely.
Queens gets its water from its own well. I'm told if Legionella bacteria is detected, it most likely would be from an internal source. Dr. Park tells me she can recall only one other incident in the past here in Hawaii where a hospital was being looked at as a potential source for Legionella infection. Live from Queens Medical Center, Jen Boniza sending back to the studio.
Jen, thank you. This is not the first time the State Health Department has investigated cases of Legionnaire's disease. Back in 2016, guests who stayed at the WorldMark Kapa'a Shore Resort on Kauai got sick. There are at least 2 confirmed cases. Those 2 people stayed at the hospital from late April to early May. The hotel took measures to keep other guests from getting sick. Legionnaire's disease is caused by the bacteria Legionella, which is found in water, and it's spread in droplets small enough that you can breathe in. The disease is a severe form of pneumonia, and symptoms include coughing, shortness of breath, fever, muscle aches, and headaches. And we will continue to update you on the latest developments on air and online at KHON2.com.